So hi and welcome to another Tea Break Talk with Cerebra, and today I'm delighted to be joined by Lowri O'Donovan, who's a research associate on a project we're working on with Cardiff University around mental health. So hi Lowri, how are you?
Hiya, yeah, I'm good, thank you. How are you doing?
I'm good, yes. So I thought we'd start off this morning by perhaps you could just tell us all a little bit about the project.
Yeah, sure. So this is what's called a knowledge transfer partnership between obviously Cerebra and Cardiff University. So we're working with the School of Medicine on this project, as well as sort of some further support from the business school. We're supported with funding from Innovate UK, who fund a lot of these knowledge transfer partnerships, as well as Welsh Government. And the aim of this project is just to make information about mental health risks and support available for children with rare genetic conditions. So these are genetic conditions such as 22q deletion syndrome, Kleefstra syndrome, and other similar syndromes where it can affect a child's physical health, but also their development. So often these children have difficulties with sort of speech, motor and sort of coordination difficulties, and they will often experience neurodevelopmental problems as well, such as autism, ADHD and intellectual disabilities. And a lot of research, including research from Cardiff University, has shown that children and adults with these conditions are at increased risk of experiencing mental health problems as well. So anxiety, depression. However, they don't tend to receive the support that they need. So this project's really trying to address the kind of lack of knowledge of these conditions, as well as the lack of support that people generally get. Yeah.
So what have you been working on so far? How long has the project been running now, Lowri? I can't quite remember.
Yeah, it's gone really fast. So it started January 2019, right. And we'll finish not this January, the next January, so January 2022. So yeah, a little while left. What we've done so far is the initial stages of the project was trying to speak to as many parents, clinicians and different charities as we could, to find out more about the kind of challenges that they face in accessing support for their children, but also from the kind of service providers' point of view, the challenges that they face in trying to provide mental health support and information for families. And now what we're kind of doing is trying to address those problems by coming up with different strategies different strategies to address those problems. And we're doing that with support from our project steering group. And they're a group of sort of key stakeholders, so parents, different charities, different clinicians, different specialities within the healthcare sector, as well as different researchers and people from the educational sector, and they kind of advise us on our plans for the project. So give us that feedback on what they think is important for us to be doing and how we can maybe go about doing that. So they're a really valuable group that we've got on board, and helps us to ensure basically that we're doing things that is as beneficial as can be to the people that we're trying to help, I guess. Yeah.
And they've recently done a piece of work, haven't they, to create a visual map?
Yes, yeah. So I can bring that up on the screen, but just to kind of introduce the vast group, when we met, we focused on the kind of discussion of improving mental health via school support. And we decided to focus on this topic because this was a topic that kept coming up when we were speaking to parents about the troubles that they face accessing support. And obviously with the current situation of COVID and school lockdown, very important and topical area of conversation. So yeah, we focused on that topic, and we had a lady called Fran O'Hara. She came along from Scarlet Design, and she produced this kind of visual map of the discussion and captured basically what we spoke about on the day. So I can bring that up if that would be...
Yeah, that'd be good to see it. Yeah, thank you.
If I can just find it amongst all of...
Good old technology.
Yeah, here we go, I think. I'll just make that sort of full screen. So yeah, we were really pleased with it, sort of how it came out. And basically it just kind of, we wanted to find out sort of why, you know, children generally find school difficult. So we brought that question to the group, and, you know, they spoke about often in terms of the academic challenges as well as sort of the social challenges that children face.
Yeah.
So, you know, often there's not the right kind of support in place for children to have that kind of optimal learning environment. And parents really have that kind of battle to put that support in place. And often that can be because of the lack of awareness of these genetic conditions and kind of the associated risks that go along with them, but also from a point of view of lack of funding and resources for schools to actually put in place what's on a child's educational healthcare plan. And then obviously from a social kind of challenge point of view, children with SEND are more likely to be bullied and find it harder, I guess, to, in quotes, fit in with their peers. And, you know, both of these aspects can really affect a child's mental health. Having said that, though, a lot of parents reported that when their child had the right support in place, that school can be a very positive experience for them. So really comes down to whether there's the right provisions for them to have a happy learning environment, I guess.
Yeah, and that's it's all really practical, isn't it? It's all, you know, written in language that everybody will understand and sort of see what the issues are and where the opportunities are as well, isn't it, to make those changes and those differences.
Yeah, definitely. And we spoke a bit, you know, about the specific challenges of lockdown.
Yeah.
And, you know, that was really interesting. There were, you know, groups really where some children were finding it really difficult to be away from school, away from their friends, and away from their teachers who are really important attachment figures in their lives. Also sort of the different routine that they're having to get used to, not being in school. But then on the other hand, you had children who really enjoyed being at home with their parents and their siblings. And as I said, school can be not a very positive experience for a lot of children, and so they were sort of taken away from that environment which they were sort of thriving, I guess, being at home rather than in school. So really kind of important things, I guess, to think about then when going back into school.
As you say, school is such a big part of life, isn't it, for you know, for all children.
Yeah.
Important that's working well and is as supported as it needs to be.
Yeah.
So what's the plan going forward then, Lowri, with the work that you've been doing with the steering group and this visual map? What are the next steps?
So specifically with the visual map, so we've already fed back what the group discussed to the Department of Education, and also Welsh Government. They published a framework very recently, a draft framework for implementing sort of a whole school approach for supporting children with their mental health at school. So we did our sort of consultation feedback to that draft. So all this sort of data is being given back, which is really good. In terms of sort of the wider project in general, we're kind of the team now are working to unpick a lot of the challenges that the group and people we spoke to previously in the project told us about, to come up with different potential strategies to improve it, service sort of accessibility. And we're looking at different models of support that are already sort of existing, and trying to see what type of things that Cerebra could adopt in this project to improve access to services for children, really. And then we'll be, our next group with the steering group is in a couple of weeks actually, so we'll be feeding that back to them and asking for their support and feedback as to what they think is the best way to go forward.
Fantastic. And we will put this visual map up on our website as well, so if anybody wants to have a longer look at it, it will be there for people to see. So that's fab, thank you.
Yeah.
You've already mentioned, about the effects of lockdown and how hard it's been and all of the impact that's had. And just to finish today, I just wondered, if there are parents, carers out there who are concerned about their child's mental health, what is it that they can do, to try and get their child the support that they need? Yeah,
I mean, we know this is a very sort of tricky subject, and not all the time it leads to the support being there, but we'd always say sort of if you have got concerns, to flag it up with the GP. If sort of your child is under a paediatrician, to discuss your concerns with them. And then in the meantime, there are a lot of charities who, there are a lot of resources and information out there. So some examples are Young Minds, got Contact, which used to be Contact the Family, and also Mind Ed as well. They've got a lot of online resources for parents. But, also thinking about yourself as a parent as well, and looking after your mental health, and having maybe a look for some parent support groups, so that you've got that kind of peer support for yourself too.
Brilliant. And you just reminded me, actually, saying that on the website we've got a couple of great guides that can help families. We've got one about emotional well-being for yourself as a parent carer, as well as your child, as well as our anxiety guide, which has got some really practical advice, of how you can spot anxiety in your child and what you can do. So brilliant. Yeah. Oh, it's so lovely to talk to you today, Lowri.
Thank you. Thank you for having me.
No, it's okay. And perhaps we'll catch up with you again, as the project develops and we've got more to report, and we can check back in and see what's going on.
Yeah, that would be great. Yeah.
Brilliant. Well, you take care, and I hope I'll see you before too long.
Yes, you too.
Okay. Bye then.
Bye. Bye.
Bye.